We've got actually, there's treatments such as IVF, which there was a Netflix TV show which went quite popular, where there was a documented woman, I think she was in the 70s, who used IVF to get pregnant. But more or less, the question was about what can women do? Because obviously after the age of 35, your chances start diminishing. What things or measures, is there anything out there for women who want to increase the chances of pregnancy after the age of 35? If you could just talk about your view on that and your take and what you found in your practice.
Yeah, I think the first thing to understand is that 35 is kind of a made up number. It's not like a finger snaps at 35 and all of a sudden people have trouble getting pregnant. As you age, the risk gets harder and harder and harder. If we look at like the Egyptians or presumably cave women, they were having babies at 12, 13, 14, 15, 16. So our bodies are really set up to have children at a younger age. And, we can see that biologically. When you are a fetus inside your mother, you actually have more eggs before birth than you have at birth. And then those eggs at birth are the only eggs you're ever going to have. And they diminish over time from the second you're born until you go through menopause. And so with that being said, a 25-year-old has a higher risk of having a genetic abnormality or a stillbirth than a 20-year-old, and a 30-year-old than a 25-year-old. And so that number continues to go down until a point where it does become prohibitively difficult to get pregnant on your own. And that age seems to be about 40. The reason that we had chosen 35 is that 35, in the 80s, the test that we used to determine whether the baby had a genetic defect, we wanted to make sure that the benefits and the risks balanced out. And so the risks of that test were equivalent at 35 to the risk of actually finding a disease. And so that's the age where it made sense for people to then go get that test. But nowadays, that test is actually still around, but much better. That's amniocentesis. And we have better tests to look for genetic diseases. So really 40 is the age where, there's diminishing returns. Now, of course, if you use a donor egg, where the egg is not as old as you are, theoretically, you could have a 70-year-old who gets pregnant. And really the only issues there are whether her body can support that pregnancy now that she has 70-year-old blood vessels and, 70-year-old heart, et cetera. But if you're looking to use your own egg, then really you just have to be aware that, there's really only so much that medical science can do, and that if you do think that you're going to want to have a child after 40, as we, start to push childbearing back, as people, start to go into the professional world more and more, that it may be helpful if you have the opportunity and the finances to freeze your eggs at a younger age so that those eggs don't age. What happens with the eggs, to get into a little bit of the science, is that the egg, as does the sperm, has part of mom's DNA and part of dad's DNA. And so the sperm is really just half. It's either mom or dad's DNA packed to the sperm. Of course, it's really a mixture of both. But the egg actually is all of the DNA. It hasn't split yet. So that egg only splits when it goes to ovulate. And so that splitting process, the machinery that breaks up the DNA and gives a piece to the baby, that machinery ages with the mom. And so at 35, that machinery is now 35 years old. And that splitting process, instead of being 50-50, sometimes can be 40-70, which means that baby that then gets created can have too little DNA or too much DNA, which is often the cause of miscarriages. And so we do anything, it'll fix that machinery. We need to get those eggs out, have them split with good machinery at a younger age, and then freeze those eggs once that split has occurred, so that then you can use that egg at any time with a good split versus having that uneven split that might happen at an older age.
But what about someone who's listening to this and they're probably 35 or 36 and they haven't done that yet? Is there anything that it's just you can only focus on what where you're at now, and is there anything that they can do at a later age?
Yeah, again, if they have the finances or the capability, they could freeze their eggs now. At least their eggs are going to be 35 instead of 40. They could get an egg donor so that they can get a younger egg. Or, if they have a partner and they're ready for childbearing, they could start trying now. I think the idea here is that, again, back to everything that, I believe in, this is all about education. And so women should be aware that, there are diminishing returns at age 40, and be aware that, they theoretically should either start trying sooner, if they have that ability, or do something to protect their eggs so that they have the ability to have successful pregnancies later. If they don't have those abilities, then, there is that possibility that they may need an egg donor, or could try to spontaneously conceive, or try to, do preconception genetic testing to make sure the eggs they do have are genetically stable. But there is going to be some women out there that just won't have the ability to get pregnant. And so, we're trying to catch those people as early as possible to protect their ability to get pregnant if that's what they want.
So these women who perhaps don't have the ability to get pregnant, is that instilled from day one, even at a young age, that they weren't able to become pregnant, or did it develop over time?
So, there are certain diseases that people can be born with or acquire that make it more difficult to get pregnant. But what we're talking about here with, baseline infertility, or I should say fertility and declining fertility over time, is really just a virtue of our genetics. It's something that happens to all women. And, even in men, we're starting to learn that the sperm is not as good of a quality as men age as well, and certainly increases the risk for certain genetic diseases. But as a women's health practitioner, we are learning that this is just a virtue, or, on the basis of women's genetics. And so this isn't necessarily a disease. It's just something that happens to us as we age.
So it's just like you mentioned, just to highlight again, if you can afford to get your eggs frozen, that's a good option, but it costs a lot. I'm not sure if some insurance covers it, health insurance plans. I heard from a friend that she worked for a company and it actually covered it. So I suppose it varies from person to person, but that's probably the only option that you have in terms of to freeze it so you can protect it, what the quality of it now as compared to as you age, it'll start diminishing.
Yeah, that's correct. A lot of insurance will not cover freezing, but some insurances will. And so it's certainly worth exploring, especially if this is of interest to you.